To welcome you all today to Reclaiming Health with Functional Medicine. We're going to be discussing how naturopathic doctors address the root causes of issues and how we restore patients' health back to full function. So next slide, please. So just a few housekeeping things to start. Everyone here is in listen-only mode. If you do have questions during the course of the webinar, we ask that you use the Q&A component down on your toolbar. You'll see Q&A, and please use that to ask questions. We are recording this, and we will share the link to the recording when that is ready. If you do have any questions throughout the course of today's event, please feel free to email us at info@aanmc.org. Next slide. And so we also want to just share that there is, this is for, I think we might have been, is there a disclaimer slide?
Oh, sorry.
Closure. Yep, there we go. So that this webinar is just for educational purposes, and we will not be reproducing it. And there is no CE for the webinar. However, folks always share that there is a lot of really good nuggets and pearls that come out from them. So with that, I'm going to turn it over to Dr. Beatty, and looking forward to some really fabulous insights.
So I'm Dr. Jonathan Beatty. Been a naturopath. I'm in my, I guess, 18th year of practice, and I began my career actually on my route to become a veterinarian. And that's kind of what led me to stumble into naturopathic medicine, because when I started studying, to be a vet, I was a very unhealthy person. I'm just going to say it that way. I grew up my whole life with eczema and asthma, and I had every lotion, potion, puffer, pill, every management tool available to me. And I was not natural medicine minded. But then part of becoming a veterinarian is you have to study nutrition. And that suddenly led me to the idea that what we eat might actually dictate our health. And from there, I changed degrees from animal biology to a degree in nutrition and nutraceutical science, and then decided to just jump ship on the animals, but only kind of, and actually change my focus to the human animal. And so I decided to then pursue naturopathic medicine because of its strong nutritional focus in medicine. And my new joke now is that nutrition is actually the gateway drug to healing. And so that's what kind of brought me along my journey. And so I've been teaching now functional medicine for a number of years. I actually work with a functional medicine medical doctor, instructing on functional medicine as well as having a clinical practice. I've worked in a variety of clinics, all sorts of multidisciplinary clinics. And then in my spare time, being the animal lover that I am, I do also operate a small hobby farm, raising, all sorts of fruits, vegetables, chickens, and then I've got a couple of cattle as well, which I guess technically makes me a ranch. And again, all of that is around the idea, weirdly to say, of functional medicine, because this is all a part of what dictates health in the human system. And it's really, that's what I want to talk to you guys about today, because it's ultimately what we're looking at is aiding the patients or aiding our clients in the return to the state of optimal human function. And that's what functional medicine about. It's about understanding what humans actually need in order to not just survive, but to also thrive. And it's about understanding physiological needs of your patient. And it's also really important on the most unsexy version of medicine out there, which is the one that I always strive for, which is preventive medicine. I always tell my patients, I'm like, my goal is not to see you. And it's not that I don't like them. It's not that I don't respect them. It's I want to teach them the habits and behaviors that are going to keep them out of mine and every other doctor's office. And so that to me is like what everybody in the naturopathic medicine field should really strive for, is creating a patient culture where they're there to learn the tools to become maximally healthy and be able to actually avoid your office, as weird as that sounds. Because in the modern medical system, let's just say we're trained as patients to rely on the doctors, that we offload our healing to somebody else. And so to me, a lot of what functional medicine is philosophically is teaching people how to take personal responsibility for their health and their health care, and start to change their life, change their lifestyle in order to facilitate healing. And then ultimately, after they've healed, facilitate long term and optimal health. And I say this word optimal a lot because there's that kind of idea of like getting out of bed and being like just good enough to get through your day, which many people are actually satisfied with, versus those of us that want to get out of bed and just have optimal function. And that's me. Like it's the you shoot for 100% every day, knowing you're not going to always get there, but that should really be the goal. And like what functional medicine is not. And I'm going to say this because I find there's a lot of practitioners out there that tout themselves as doing functional medicine. You see a lot of medical doctors that and people that they take a weekend course. They learn a little bit about, say, like the importance of magnesium and B6. And because they start incorporating vitamin therapies into their practices, they decide this is what functional medicine is. But it's not actually just about applying herbal medicine. It's not just about applying orthomolecular approaches. And for those of you who don't know what orthomolecular means, it's kind of using pharmaceutical levels of nutrients. So, the idea of taking, say, massive doses of vitamin D to promote to improve your immune function to fight off viral infections. And I'm not opposed to that. I actually do that all the time with patients where we do use megadoses of vitamin D to fight certain infections. But that being said, that's not entirely what functional medicine is. It's not just about applying special dietary interventions. So, for instance, if you had somebody that's gluten sensitive, teaching them that and then making them avoid gluten, that can be part of it, but it's not just that. And it's not focused on necessarily diagnostic labeling. And that's the other point where people say, oh, well, you're a cardiovascular disease case. You've got high blood pressure, high cholesterol, maybe some other kind of arrhythmia or something. And then we're doing functional approaches to treating that single kind of condition or area of the body. Functional medicine is more, again, about returning the patient to their optimal human function. So it's looking beyond their disease, it's looking beyond their immediate medical needs and looking at like their immediate medical needs, but also their long-term human needs. And that's like my key thing. So it's like disease is merely a representation of some imbalance in your normal physiology. And how that presents can be very, very like wide and broad. So, symptoms, and this is my biggest pet peeve. Symptoms are not a diagnosis. And this is a trap and a pitfall that even in the naturopathic profession, we do fall into, but where we'll start diagnosing people with hypertension, or we diagnose them with migraine headaches, or we diagnose them with eczema. These are all states or presentations that the patient has because of some deeper fundamental physiological imbalance. This is how their body's representing disease in them, but it's not their fundamental, it's not their fundamental state. Like it's a symptom. And again, the same thing with signs. So being able to, and a sign is something that the patient doesn't tell you about or you measure. It's something you measure with, like, say, blood work or something along those lines, where it's, they've got high cholesterol. So their body's showing a sign that there's a disease process and that it's trying to heal. But that's what the cholesterol is there for. Or the idea of osteoporosis. There's a sign that bone metabolism has not been functioning well. Or leukopenia, so they don't have enough white blood cells. So again, these are things you're going to find on somebody's blood work or in a DEXA scan or something like that, that are signs that the patient isn't well, but they themselves are, again, not the full diagnosis. It's the totality of signs and symptoms are the way to help you recognize the needs of the patient. And that's what functional medicine is. And it's in a way, it's basically what naturopathy should be in its purest form and is in its purest form, where what we're doing is you're looking at that patient, you're looking at what their body's telling you. So when you look at somebody, you see that, say hypertension, hypercholesterolemia, osteoporosis, leukopenia, that body is screaming for help, and it's trying to kick out all these symptoms and signs as a way of responding to its needs, but also as a way of signaling to the person that it has these specific needs. And it's not an actual like functional medicine is a concept. It's a philosophy by which you help your patients. There's not any one sort of specific group or institution that like owns the rights to the idea of functional medicine. It's more of a philosophy by which you can approach your patients. And so I'm going to kind of teach it to you guys in as brief a way as I can tonight, which is from six key concepts that I personally use in order to evaluate the health of my patients and restore their health and eliminates like some of the most complex disease states. Like I don't care if a patient walks into my office with, progressive MS, or they come in with simple, I want to be healthier. I'm going to approach them the exact same way and not get at all flustered by the state of the diagnosis. And so it's implementation, what it really requires to perform functional medicine is a huge understanding of human physiology. And the other thing that I recommend all of you do, because this is what ends up happening in every naturopathic college and medical college around, is we end up studying the aberrations of human physiology, the disease states. And what we don't spend enough time doing as doctors is studying the habits and behaviors of healthy people. Because my question that I would pose to you is, how do you expect to get a patient to a healthy state if you don't understand what the habits and behaviors of health actually are? And that is a key kind of component of what functional medicine is. Because otherwise, it's kind of in a way the blind leading the blind. Like we're taught, like, here's kind of like human physiology in its normal state. And then here are all the disease states and the sort of deviations from normal. But if we're not studying all those areas and those habits that make you and keep you healthy, how are you ever expecting your patients to heal? So yeah, sure, somebody's got high blood pressure and you start throwing some hawthorn and magnesium and CoQ10 and some of these interventions at them. And maybe you get lucky and you correct the physiological imbalance in that person, or maybe you don't. And so you might only provide them with temporary relief by kind of forcing their body into a direction the same way a pharmaceutical will, but you're not actually curing that patient. Whereas if you understand why they're presenting to you with high blood pressure and you address that cause, you're going to have a much more lasting and effective approach. And so my kind of 6 pillars that I look at everybody at is hydration. And this is, again, humans are basically big bags of water, for lack of a better term. And it creates the environment for balanced intra and extracellular fluid levels. And then here's the craziest thing on hydration. There is no medical standard for what we call dehydration. So we have all these ways we kind of look at somebody and suspect that dehydration exists, but there's not actually a clinically recognized universal diagnosis for dehydration because it affects different people so differently. And you start getting all sorts of weird compartmentalization issues of water in people that say might be hyponatremic. So if you're low in sodium, your body's going to compartmentalize water incorrectly, and it'll actually create a dehydration that you won't necessarily easily see. The other one is nutrition. So this is another area I look at people because by definition, so a nutrient by definition are the basic molecules required to support and sustain life in the absence of disease. So what that means is by definition, any level of nutrient deficiency is automatically creating a disease state in that person's body. And so functional medicine is about identifying those deficiencies, no matter how small, and then restoring nutritional adequacy so the body can function. It's like giving somebody a Lego set to build a car, and you only give them 3 wheels. I don't care how many ways you put that car together, you're not getting the finished product that you're looking for. And that's what the human body is when there's any level of malnutrition. Sure, it's got 3 wheels, it's close, but it's not adequate to create the end state that you're looking for. The other area that often interferes in creating that proper end state is toxicity. So it's any poison that disrupts the normal physiological pathway. So like a classic example is something like lead. So we hear about lead poisoning, but part of the reason lead is so toxic is it displaces other 2 positive ions. So it'll replace calcium where it's needed, or it might replace zinc where it's needed and change the way those proteins fold, change the way that certain channels or transporters work because it's interfering by displacing other nutrients. And so toxicity often works by nutrient displacement. Then there's, of course, physical trauma. That one's pretty basic and self-explanatory. Whiplash injuries, you fall off a building, and the human body is just not designed to necessarily sustain those things. And you get fractures, and you get other injuries, and those dramatically impact the functioning of the body. And then the other area we don't often talk enough about is emotional trauma. So the thing is, when you change the way the brain thinks, you're also changing the way the brain regulates. And so, we talk about, just my simple example of this one is all the phrases we use for feeling anxious or nervous. And it's like, my stomach's doing flip-flops, my stomach's in knots, I've got butterflies in my stomach. Right away, we think, something like anxiety, we might say it's a mental disorder. But yet all of our phrasing around it is digestive. And so you start to see that how, like, just being nervous will literally change the digestive function, which can then lead to nutritional imbalances, hydration imbalances, so on and so forth. And again, they don't necessarily automatically normalize when, say, an emotional trauma has been long-standing or it was acutely severe. And then, of course, we've got our lifestyle factors. So humans were never designed to be cave dwelling, sedentary cave dwellers. That's just not our ancestry. We were out hunter gatherers. We were outside in nature, all of the time. We were climbing, we were moving, we were chasing, we were picking berries. And in the modern world, we're doing what we're doing now, which is sitting in front of computer screens, probably indoors. And that's very different from how humans were designed to kind of function and how we've kind of adapted to our environments. And then, of course, there's other factors such as sleep. So people who, again, due to work or occupational issues or whatever, don't sleep enough. Or again, just don't frankly get enough sunlight. People that live in cities that work in office buildings and then they sleep in, and then they own a condo, for instance. Nothing wrong with that lifestyle, but you have to acknowledge that you're spending most of your life indoors. And even when you go down on the street, how much sun do you actually get between the large buildings? Not a lot. And then when you're inside, even if you've got windows, those windows are actually designed to block ultraviolet rays, which work as signals in your body. And so here's another way where simple sunlight exposure can dramatically affect how your body's behaving. And again, if we go up to nutrition, and this is where all this functional medicine ties together, and we talk about something like vitamin D. Well, vitamin D is created through, essentially the short of it is cholesterol reacting with the sun's radiation. But if you're behind UV protectant glass, that actual chemical reaction doesn't happen because the glass is blocking out that necessary UV radiation in order to convert cholesterol into vitamin D. And so here you can see how functional medicine is connecting all these kind of, even these 6 pillars interact with one another, and you can't kind of analyze any of them on their own. And so, like, ultimately, this is that area that I really love, because what I love about naturopathic medicine is this, is it allows for a broad understanding of human health. And so in its purest form, it focuses on the healing powers of nature. And I know we talk about this a lot, but the example I'm going to use is if you fracture a bone. And so you head off to your local urgent care department, and the kind doctor that works at the urgent care department, they're going to go through and they're going to realign the bone, and then they're going to hold it in place, and by casting it or splinting it. And that is the extent of the medical intervention that's required in a standard fracture. And then the human body is going to take over. And what it's going to do is it's going to create a callus around that fracture to strengthen the area to hold it together while it relays what's called the trabecula, which are all the canals in the bone that contain, the arteries, veins, nerves, the marrow, so that the living bone, which again, bone is very much alive, can begin to heal. And then after it's relayed all of this trabecula and relayed its structure of hydroxyapatite, because again, bone is much more than just calcium. It's a mineral. It's mainly made up of a mineral called hydroxyapatite, And it's also made up of a lot of protein. So it's going to relay that entire protein matrix upon which it's going to build a hydroxyapatite mineral structure. It's going to have all this trabecula, and then it's going to reabsorb over time that callus that's formed around it. And this is where functional medicine is so important because let's say, for instance, you're dehydrated. Well, simply being dehydrated can actually slow the transmission of required nutrients to the fracture site, but it may also restrict your body's capacity to remove waste products from that damaged tissue because most of the body works through osmotic gradients, which is, you're taking a high concentration and you're needing to basically transport it to an area of low concentration. But if you're dehydrated, it's much more easy for that area of low concentration to balance out with the area of high concentration. Thus, then again, slowing the extraction from that site of waste products, metabolic byproducts. So it's kind of like having a car where the exhaust is blocked. So sure, the engine can run, but if you can't get rid of the exhaust, that's actually going to cause your engine to stall. And so that's just even how hydration will affect the bone healing. Then we've got nutrition. Well, if you have a fracture, your protein requirements actually increase because, again, you need that added protein to be able to repair the underlying bony structure. And you also have an increased need for minerals acutely. So, of course, calcium, but as I mentioned, bone is much more than calcium. So you're going to need silica, and you're going to need zinc, and you're going to need boron, and you're going to need strontium. You're going to need magnesium and everything else that makes up the mineral complexes of bone. So any level of deficiency in any of those mineral complexes or in the protein is going to slow the body's ability to heal. It might know what it needs to do. It might have the blueprint, but if it's waiting on raw materials, that alone is going to delay the healing of a broken bone. Then we go into toxicity. I'm going to go back to lead. This is why I dropped lead on you guys earlier, because lead in its one of the areas the body stores it is in bone. And this is actually why in some rat studies, we've actually shown that lead toxicity can last 7 generations. So what that means is if you lead poison a rat, its great grandchild can have lead poisoning from that initial bolus of lead given to the great grandparent. And that's because it gets stored in bone. And then every time the rat gets pregnant, it's pulling that lead out of the bone and installing it in the skeleton of the newborn or the developing mouse. And then of course that rat's born with lead toxicity in its bones, and so on and so forth through generations. So here's another area where if you've got high lead exposures or you've got some lead poisoning, and your body starts metabolizing minerals, and all of a sudden, instead of building that hydroxyapatite with calcium, you're now building it with lead, and you're going to get a very different structure. So that's where that toxicity is going to come in. Physical trauma. Well, let's say, you break a leg or something, but because of a work obligation or whatever it is, maybe you've got young children. It's hard to stay off of the leg. And so as the bone's healing, you end up, standing on it, pushing on it, subtly shifting and, ultimately deforming or breaking the protein structure, deforming or breaking the newly forming mineral complexes. And that, again, is going to cause slowing of the healing. And then even with emotional trauma, that might increase things like stress hormone, which is going to actually affect osteoblastic activity. And the osteoblasts are the cells that form the bone. And so here's again where emotional trauma alone can actually slow bone healing. And so when we start to look at all the functions, the kind of different premises behind tissue healing and behind functional medicine, we can see how, so far I've covered 5 of them. Each one of those various areas of analysis can be impacting that patient's healing. And so it's a good idea too to teach your patients not just like about these ideas, but actually how to think about their own healing from this perspective. So it's kind of reframing health to them. And then even from lifestyle factors, I mean, if you have a significant tissue injury, well, most of your healing happens while you're sleeping. But if that person's not sleeping enough, let's say they've got insomnia, maybe they've got, again, a very busy work schedule and life schedule, and they just don't sleep enough, you're going to see delayed healing. So this is where it's really important to be addressing all levels of healing for your patients and looking at it from a very holistic, full body approach, but like not just full body, but total life approach. And again, like naturopathic medicine, we're focused on returning the organism. And by the organism, I mean most people who are naturopaths are treating humans. That being said, I know some naturopathic veterinarians, people that treat animals. This approach works for all animals. I even know people that literally use these same approaches in their in how they raise plants and how they work with plants and farming. And so again, it's an idea on returning harmonious relationships with your environment. And the one thing that I really love about what we do as naturopaths is our broad scope, where the way in which, again, state to state, province to province, this is going to differ a little bit. But in the field of medicine, there's what we call medical standards. And so a lot of the time, many doctors and many physicians are kind of handcuffed a little bit in their approaches that they're allowed to take with patients because of what are called standards of care, which is, the systems created when you see a certain patient, there's an expectation that you're going to address that patient with a very specific approach that's kind of like the pre-approved, pre-acknowledged, universally accepted approach. And admittedly, it's not always what I would consider the best because they don't, again, look holistically at the patient and the individual needs of that patient. These are standards that are sometimes created, to catch the majority, but it doesn't catch everybody. And the one thing I like about naturopathic medicine is because we have such a broad scope of practice, that usually allows us in most jurisdictions to actually truly be able to implement functional medicine in its purest form, where we can actually address the nutritional needs of a patient. We can address hydration. We can address, many times we're licensed in most states to actually work as counselors and to counsel and coach people on healthy living styles. And so this is one of my favorite things about being a naturopath and about being practicing functional medicine is taking some of the most complex patients with some of the most complex diseases and actually being able to not just manage them, not just make people more comfortable in their disease state, but to actually reverse the disease process by, again, providing all the needs. And this is why earlier I said it's not just about nutrition and how I kind of joke nutrition's the gateway drug. And the reason a lot of us like it is because it's one of those most controllable factors. And it's usually one of those factors where we're going to see the fastest results. The other on that is hydration. I say for with my patients, right on my treatment plans, I have how much water they need to drink, and I give that to them right away. And usually the second appointment when I see them, the first question out of my mouth, besides how are you doing, is usually, how's your water intake been? Have you been able to follow the hydration plan? And people, it's about 50% of people are like, nope. And I say, right away, I'm like, well, how you been doing? And they're like, well, I'm a little better, but not as good as I, thought I would be. And I'm like, yeah, but you're not sticking to the plan. And this is where it's important that we call people back to what we've asked them to do, review with them, and really draw attention to how important these things are. Again, hydration, every chemical reaction in the human body that I'm aware of anyway, and there could be some that this doesn't occur in, they all occur in water. Water is that universal solvent inside of us. It literally is what creates the electrical potential across membranes. And it's what allows us to create neurological, like the energy and the electricity of our nervous system. It allows us to compartmentalize different different products away from one another. So it's what allows us to kind of, ultimately create cells, but then also have that all that extracellular fluid and all of the lymphatics and all that other stuff that basically makes our body work. And I don't know, that's not the most technical approach to describe it, but it's such a grand concept that it's almost impossible to actually describe. And that is, again, to me, what I love about doing naturopathic medicine is there's never any ending to our learning. And especially when you approach it from a functional medicine perspective, because every single day we're learning more and more about human physiology. I mean, one of my things that I often say is the moment you think you know everything about human health and about naturopathic medicine or medicine in general, and you think you know everything about physiology, is the day you should retire because that's the day you start to become dangerous. And the most beautiful thing of naturopathic medicine is we're always learning. We're always taking courses. We're always going back and trying to understand more and more and more about human health. And that really is what functional medicine is all about. It's about constantly learning what makes the human animal function in its most optimal form, and also understanding that every single person is an individual and has slightly individualized needs. And that's kind of the fun of medicine is we get to investigate each of those individual needs, and we get to sort of work with all these different people and see, all the standards, and you see all the deviations from standard. And it really just means you never grow bored. That's the one thing I love is I never grow bored in what I do. And I thought I learned a lot in naturopathic school, and I did, and it's intense. And I've learned even, and to me, I always say like that's like it's like learning your alphabet is what naturopathic college is for. And then when you get out and practice, that's when you learn how to write poetry. And so it's like but you need to start with those fundamentals. They're incredibly important. And some of the courses that you may find, kind of boring in your first or second year because they're really kind of generic and basic, I would argue are actually some of the most important courses you'll ever take because they're about the true basic function of like a kidney and what it's there to do, or like the adrenal gland, which please, please, please learn as much as you possibly can about adrenal glands because they're incredibly powerful and often overlooked and again, often misunderstood. We think they're very, very simple things, but without getting too far into the pharmacology of it, they're literally the adrenal glands are the target of almost every cardiovascular medication. Not all of them, but almost all of them affect some sort of adrenal related compound. And so this is why it's so important that we understand human physiology, because then even if you see what's working pharmaceutically with a patient, that will as well give you clues about what's happening in that person that's sitting across the table from you or, lying on your treatment table, whatever it may be. It's like, you're just constantly playing medical detective. It's just like I always joke about being a natural doctor house with a better bedside manner and a lack of narcotic addiction is what I get to do for a living. So, yeah, if I have one piece of advice, looking forward to all the future doctors and doctors out there that are listening to me rant and ramble, spend as much time as you possibly can studying longevity, study the habits and behaviors of healthy people, and try to put together what it takes for humans to live long, healthy, happy lives. And be cautious of studies that are 6 weeks long. Be cautious of studies that are 3 months long, because sometimes you get these kind of initial dramatic changes in a marker, but it doesn't necessarily translate into longevity. And so with that, I always say is like look at studies and look at what it is in different cultures and what it is in different diets and what it is in different habits and behaviors that lead people to health. And again, like what's my future look like? Mine is sharing knowledge with the next generation. This is what I love to do. This is why one of the reasons I accepted the opportunity to speak to you tonight is because I absolutely love functional medicine. Like if I stopped getting paid for this, I would still do it. And it's and not that I'm paid for tonight's presentation, but for work. And so this is why I also teach courses on functional medicine. because I genuinely believe in it. And it's, again, to be a doctor is to teach. It's not to be a technician. Doctor comes from docere, which is the Latin root of to teach. And so to me, that's the most important part of what we do, where it's like we teach the habits and behaviors of health to our patients so that they don't need us. And it's kind of like a bit of a shift in how medicine works. But to me, it's the most important approach that we can take, because it's not just shifting our patients. For me, it's like shifting a community. I've always said that the day I've reached peak success is the day I have an empty waiting room. And when I don't have any more patients to treat because I've finally created a healthy community in which I live. And, that may not happen in my lifetime, but I'm hoping in, the next generation's lifetime, that will be a thing where we actually have a personal responsibility about healthcare. And we've got an informed populace that knows how to care for themselves. So our needs for, medical attention actually go down because we're able to live those healthy lives. So thank you for listening to me rant and ramble. If you need to find me, these are my contacts. And you can find me on social. I'm not a big social media guy, as you can probably tell from my one Instagram and lack of Facebook. But yeah, email is a great way to get in touch with me if you have any questions about what I do. So thank you.
Thank you so much, Dr. Beatty. So before we move on to question and answer, there are a few starting to come in. I see those coming through. Next month, we have our ND school experience with students. So you can hear directly from current students at each of the programs. And then in October, we're going to be talking all things sugar just before Halloween to provide a little bit of insight in how NDs recommend lowering, decreasing your sugar intake. So that is that. Next slide, please. And if you do have any additional questions before we wrap, here is our contact information. So with that, Dr. Beatty, a few questions have come in. What is the difference between functional medicine and naturopathic doctor? And I know that you talked about different practitioners and their training and what have you, but maybe if you could just touch on that.
Well, I mean, really, in its purest form, I'd say the overlap is there. What I'm going to try and be as kind of like friendly about this as I can, but it really what I find is many naturopaths, we kind of get a little slack and lazy in our approaches and kind of turn into green allopaths where it's just, herbal swaps for pharmaceuticals. Whereas like naturopathy is about that vis medicatrix naturae, the healing powers of nature and supporting the human body in its healing, in its true healing. And so I'd say really, depending on how you practice, there is no difference between functional medicine and naturopathy. It is one and the same.
Thank you. The next question, and I'm sure in your 18 years of practice, I know I have had to deal with folks who are skeptical of what you do, or maybe just misinformed about what you do. How do you deal with that? I know we have prospective students that may not, they may be getting pushback from relatives or, significant others, like, what is this thing that you're doing? Why do you want to do this? And so how do you respond to folks who may be skeptical or may have some misinformation?
Well, that's a bit of a tough one because it ultimately depends on the question. But oftentimes, what I'll say is like, well, what do you have a question about? And have you actually bothered to look it up? Because, a lot of people will, they'll say like, well, this is the only intervention. I say, well, what if somebody had a nutrient deficiency? Like we have iron deficiency anemia, for instance, or something like that. Like there's a lot of good evidence around herbal medicines, or that 95%, and again, depending on I don't know how old this statistic is, but 95% of all pharmaceuticals are herbally derived, that they came from original plant constituents. So I'll say, like a lot of what medicine is actually originated in naturopathy. And this was like the original focus, and that there is actually tons of research on it. And it's just, it gets, how do I say, it gets insulted a lot, mainly, I think, out of territorial defenses. And what's most profitable or patentable is a lot of what it is. But yeah, no, other than that, like it's actually very well researched. It's kind of how do I say it? It's under respected, but I think out of ego more than anything, and I think out of an attempt to sort of maintain control in the medical system. It's kind of my my politically friendly way of saying it.
Thank you. Uh, let's see here. So uh, oftentimes a lot of the things that you discussed are for treatment may have a lifestyle component to them. And lifestyle type treatments can sometimes be some of the hardest to implement. So there's a question here from Mark about how do you get folks to make those tough changes and to stay consistent with that? What's the psychology of that?
Well, honestly, it's like half of what we do is coaching. Like most people know it's better to eat kale than candy, as you're going to learn in October. But we still go for that candy. So a lot of it gets into coaching, and like I do a lot of psychology work with people around self-worth, like that you are worth making these changes. I do a lot of psychological work around boundaries with friends and family. And again, the idea that, other people, if they have poor self control and they don't feel that they're going to be able to make healthy changes themselves, they'll actually try to derail you from making those lifestyle changes because they don't want to see you succeed at it, or they don't want to feel less, have a lower sort of view of themselves, being like, oh, I could never do that. Like, how can she do that? And so they'll actually try to derail you from it. So it is a lot of you end up doing a lot of coaching almost more than anything in medicine. And that's the biggest thing. Because the moment you ask anybody to do anything besides swallow a pill, and even that, look up what pill fatigue is. You'll run into patients that they get just tired of swallowing pills, whether it's from you or their medical doctor. In fact, that's many times one of the reasons people come to me is they're tired of what they've been doing. And so they need that change. And so a lot of it is I turn it on them and I ask them a lot of questions like, why are you here? Like what's your purpose of this? And you make them do the deep dives. And so yeah, this is why I kind of mentioned it's a lot of counseling and it's a lot of coaching. And that's honestly, that's the art of medicine, is figuring out, because the same coaching technique doesn't work with everybody. Like one thing I would say to look at is the work of Gretchen Rubin, who is the author of that book, The Happiness Project, and she wrote a great book called The Four Tendencies. And I don't have any affiliations with her. I don't get any kickbacks, but it's kind of like personality types. And there's four major personality types. It's with respect to expectations around change. And so that's why I like it so much, because it helps you identify quickly identify what an individual's needs are. And it's the same with understanding the five love languages, which is again one that's often overlooked, but it starts to help people understand what they themselves need and what they're looking for. And once you know their love language, you can use that as a reward for the healthy changes. So I hope that helps.
Thank you. Yeah, so often finding an anchor within that person's value system. There's kind of a similar question about, if getting folks to change their diet mindset, and it does vary depending on the patient. It's also going to vary depending if they've got a history of eating disorder or anything else on board that would make you, be a bit more cautious about how you're going about making changes. But to your point, finding how they respond and what that anchor is for that person is probably the biggest key. So with that, Dr. Beatty, thank you so very much for joining us today. I very much appreciate you sharing your wisdom, your 18 years of hard-earned intelligence and more than that. And so thank you so much. I know it's a little bit later by you and in Canada right now. So thank you for spending your evening with us, and hope to see the rest of you at a future event. So that we're going to wrap. Thank you all for coming tonight.
Thank you so much for having me, and I really appreciate you having me on. And hopefully, I inspired a few people to join the profession, because it really is the most rewarding job one could have. Like you almost forget it's a job someday. Thank you.
So much. Thanks for coming.